Today we're going to talk about the Affordable Care Act, otherwise known as the ACA. Brought to you by University of Maryland University College's HCAD 620, the United States Healthcare System, and the Group 3 team. So what is the Affordable Care Act? The Affordable Care Act, also known as Obamacare colloquially, is a United States healthcare reform law signed on March 23, 2010 by President Barack Obama that expands and improves access to the care and curbs spending through the regulations and taxes. The focus of the ACA is to give access to affordable health insurance, improve the quality of health care and health insurance, regulate the health insurance industry, while reducing healthcare spending in the United States. The ACA does a lot of important things, including offering Americans a number of new benefits, rights, and protections in regards to their health care. By setting up a health insurance marketplace, healthcare.gov, where Americans can purchase federally regulated and subsidized health insurance during open enrollment periods. Also expanding Medicaid to many adults in many states. Improving Medicare for seniors and those with long-term disabilities. Expanding employer coverage to millions of employees. Requiring most people to have coverage each month from 2014 in order to get an exemption or pay a fee. In August of 2011, President Barack Obama responded to the Republicans' use of the term Obamacare by saying, "I have no problem with folks saying Obama cares. I do care. If the other side wants to be the folks that don't care, that's fine with me." So who are the newly covered? HHS's 2015 estimate of newly insured, those who have coverage and who wouldn't have before the ACA, was 16.4 million. The ACA expanded coverage to millions of previously uninsured people through the expansion of Medicaid eligibility and establishment of health insurance marketplaces. ACA will ensure health insurance coverage reaches millions of low-income Americans, children who have pre-existing conditions, who were previously denied, young adults as a result of dependent coverage, expansion to 26 years of age, adults with low or moderate incomes, African Americans, and Latinos who are high risk for lack of insurance, rural population, poor and nearly poor non-elderly individuals, people with job insurance coverage, same-sex couples, retirees, people who are incarcerated. This graph shows that 1/3 of the newly insured are insured because of the Affordable Care Act. And this was brought out by the Kaiser Family Foundation poll in 2014. This is achieved by eliminating lifetime and unreasonable annual limits on benefits, prohibiting rescissions of health insurance policies, providing assistance for those who are uninsured because of pre-existing conditions, necessitate coverage of preventative services and immunizations, extending dependent coverage to age of 26, developing uniform coverage documents so consumers can make apples-to-apples comparisons when shopping for health insurance, putting a cap on insurance companies' non-medical administrative expenditures, ensuring consumers have access to an effective appeals process and provide consumer a place to turn for assistance navigating the appeals process and assessing their coverage, creating a temporary reinsurance program to support coverage for early retirees, establishing an internet portal to assist Americans in identifying coverage options. Now let's talk about some of the health insurance exchanges. The passage of the Patient Protection and Affordable Care Act, or PPACA, in 2010 heralded big changes in the way that health care is both valued and delivered. One of the biggest components of the PPACA is that health insurance exchange system. Exchanges are a new way of purchasing health insurance. They are closely intertwined with some of the other important aspects of healthcare reform that will impact individual access to medicines. It is the most basic form. An insurance exchange is a new organization, either a government agency or a nonprofit, that offers a choice of exchange-certified health plans to residents in a state or region. An exchange is intended to work like a marketplace where residents buying health insurance can compare the different available plans within their exchange by encouraging competition among plans. The exchange can act as a catalyst to reduce healthcare costs while also improving quality and efficiency. Different states are taking different approaches when it comes to these exchanges. One of the major components of ACA is the health insurance exchange system. Exchanges are new ways of purchasing health insurance, and they are closely intertwined with some of the other important aspects of healthcare reform that will impact individual access to medicine. These exchanges could be operated by a state, by a region, or by a state in partnership with the federal government. Nevertheless, at the moment, different states are at different stages in establishing exchanges. Certain states like California, Colorado, and Vermont have already enacted legislation back in 2011 that would create an exchange. Some other states like Texas and Florida have chosen not to create a state-based exchange, while other states have not even enacted legislations that will create these exchanges. If states do not establish an exchange or are not ready in time for the 2014 start date, the federal government will establish and run its exchange in those states. For instance, Maryland's exchange is state-run, and the establishment law was enacted in 2011. So let's talk about that healthcare exchange variation by state. If your state is defaulting to the federally run exchange model, then the exchange website for employees, employers, and brokers is www.healthcare.gov. If your state is running its own health insurance exchange, it will have its own website. Under the ACA, states can decide whether or not they will expand eligibility to the Medicaid coverage. Each state has their own exchange and different regional populations and demographics. Each state will have varying number of providers, number of plans, and the prices. So right now there are 7 states that have federally supported state-based marketplace. 13 have their own state-based marketplaces. 7 have a state partnership marketplace. 27 have federally facilitated marketplaces, and this is by the Kaiser Permanente Family Foundation in 2016. And this gives you an idea of looking at the health insurance exchange and who has what. You can see that Maryland has the state-run exchange in the color of green. Anything that's federally facilitated is in the dark blue. Purple is federally run individual marketplace. A state-federal partnership is in the light blue, and a light green is state-run exchange using federally supported website. Let's talk about the discussion of being able to compare apples to apples when we discuss coverage tiers. So all plans, regardless of state, will fall into one of 5 levels of coverage: bronze, silver, gold, platinum, or catastrophic. The paid by the plan amount includes all of the allowed benefits. Most people will be required to have insurance that meets the bronze level. Those who do not will pay a federal tax penalty. Premium subsidies are calculated based on the second least expensive silver plan available in the exchange. The percentage a plan pays for any given enrollee will be different from the actuarial value, depending upon the health care services used and the total cost of services. So you can see below, bronze, the plan pays 60, the insured pays 40, and it progresses up to platinum, where the plan pays 90% and the insured pays 10. Then you have catastrophic for those awful times. So what does Medicaid program have to do with the ACA? The ACA Medicaid changes that will impact the enrollment. It's going to increase the amount of people who are covered and decrease the amount of people who are uninsured, especially in the states that have chosen to expand. This will increase the stability and the continuity of coverage in all the states. And we will be looking at trying to create more outreach for enrollment in order to help. This gives you a better idea of what the new face of Medicaid is as it relates to expansion, which we will discuss a little bit later. Now we're looking at a younger population, more males, more white, less obese, less depression, more of them are smokers, and more drinkers. The reason being, with expansion, we are able to get people who are working, but they don't fit the criteria for being able to afford insurance on their own. So how will health insurance premiums be affected as a result of the ACA? This is where people are starting to notice when you're not part of Medicaid. The Commonwealth Fund has started to say that by 2020 we are going to be looking at a 24% increase in our premiums as a percentage for our median family income. And you can see that in 2016 we're at a 21%, and some people are already feeling that increase in how much they're paying for their health care when they are in an employee-based insurance. One way to alleviate this is that there are tax credits that can help when you purchase your health insurance, and this is one way to look at it. And basically, you may be more likely to be able to go under Medicaid, but in order to get a tax benefit while you are under an employer health benefit, your premiums have to exceed 9.5% of your income, which for many people is just not logistical. Let's talk about Medicaid expansion. It became effective on January 1st, 2014. States had the option to expand Medicaid. Americans 65 or younger with a household income of less than 133% of the federal poverty level may enroll. States will receive 100% federal funding for the first 3 years. States must create a simplified eligibility process for individuals to enroll. Medicaid eligibility is not being changed for the aged, blind, or disabled individuals, foster care children, SSI cash recipients, this gives you an idea of, in January 2016, what states had chosen to expand, which ones are in the process of doing a waiver expansion, and what of 19 states are not expanding at this time. We can see that Maryland has expanded. They are at 138% of federal poverty level in order to be eligible for Medicaid. What this expansion does is it's filling the current gaps in coverage that we were having, where when we had this umbrella in the past, there was this entire section of people who were the working poor and were unable to get insurance as a result of it because they didn't fit that federal poverty level. And the June 2012 Supreme Court decision said that that the states had to offer, had the choice to make the decision whether they wanted to make the Medicaid expansion as it was stated. So there's been the ACA has been a highly debated subject for both federal and state governments, especially between the Democrats and the Republicans. Although both the Republicans and the Democrats agreed that the health care reform was necessary, their views and approach were significantly different. At the beginning of the implementation of the ACA, the Republicans immediately launched a campaign to repeal the law, and many states joined in the lawsuit in order to challenge the ACA. Costs through the ACA, there were 3 types of cost assistance. You have premium tax credits, cost sharing reduction subsidies, and Medicaid CHIP. Quality standards in place for insurance plans, services had to be provided at no cost to the insured and limited to out-of-pocket costs. Then we need to discuss quality. Hospitals with higher than expected rates of readmissions of Medicare beneficiaries were subject to financial penalties, and decline of hospital-acquired conditions around the nation happened as a result of them not being paid if a person was received something such as MRSA as a result of being in the hospital. Let's talk about access. Expansion of Medicaid eligibility to nearly all low-income individuals at or below 138% of poverty level increases the assistance. 19 states, as we discussed, have not expanded their Medicaid programs at this time. Coverage gaps for families who do not qualify for Medicaid are the marketplace premium credits, where you can get insurance at lower costs. So how well is ACA coverage working for people with enrollees? And this shows you that 91% of United States adults who use their insurance to get health care are satisfied with the choice of doctors that they have. 77% of these adults who tried to find a new primary care physician said it was easy to do so. And 60% of those who found a new primary care doctor were able to get an appointment within 2 weeks, which has been very good. And this is from the Commonwealth Fund Affordable Care Act Tracking Survey in 2015. So ever since the ACA was signed into law, there have been strong opposition who have voted to repeal it numerous times. Taking multiple polls, it seemed that more Americans oppose the ACA than they support it. Even with some parts of the ACA are popular, like the exchanges, independents can stay on with their guardians until the age of 26 years old. Millions have benefited from the eligibility rules of Medicaid as well. The opposition has control of both houses, in Congress, an attempt to repeal the ACA and replace it with another act that will keep the most popular aspects of the ACA. Some states have put into place measures that do not follow the stated goals of the ACA, some of which are not expanding Medicaid, not participating in the health exchange or marketplace, blocking individual benefits, and placing restrictions on navigations. States are not allowed to change eligibility standards for CHIP from what was put in place in 2010. Large employers may have to make payment if adequate affordable coverage is not offered to their full-time employees, and one or more of those employees get a premium tax credit. Small employers that cover at least 50% of full-time employees' premium costs may be eligible for the small business healthcare tax credit. If both employers self-insure, a fee may be required to help fund the Patient-Centered Outcomes Research Trust. The individual's share of responsibility provision requires workers, their spouses, and their dependents to have qualifying coverage for the entire year. If workers and others do not have qualifying coverage, a payment will need to be made with the tax returns when filed. So in conclusion, although not perfect, the ACA is overall a good law for the following reasons. It ensures affordable coverage for most middle-income families, provides tax credits for small businesses, it increases coverage for employees, covers preventative health services with no copay, makes prescription drug coverage more affordable for seniors, rewards quality of care rather than quantity, reduces childhood obesity and tobacco use, expands coverage for young adults, strengthens the primary care system, and supports community health centers. We hope you found this informative and learned something new in regards to the Affordable Care Act. We look forward to any questions that you have. Please post them below, and we hope that we can get back to you within 24 hours. For more information, please see our references below.